The thing that bothers me the most about healthcare today is the unwillingness of the medical community to uh, give information, the rightful entitlement to individuals of their medical information, which has got to change. Well, there's a combination of things that explain why this is such a serious problem, one of which is a deeply ingrained paternalism. But the fact that still today 70% of physicians in the United States are unwilling to give their clinic office notes to patients indicates that it's deeper than just paternalism. It's fear about loss of control. It's concerns about the medical legal landscape that we live in. So there's many reasons, but we haven't made the progress that we need to, that gives a respect to each individual about their medical self. The book took about 2 years of research with a lot of reading, and I had to learn all about the printing press and its impact, and all about no one had ever really done a book about the paternalism in medicine, so it took reading so many different books and articles. I learned a lot. I learned so much, and even though it was kind of my evenings and weekends and holidays, I thought it was worthwhile because I think it's something that everyone should ideally learn about. And the fact that we can have a whole new beginning of healthcare that's rebooted, and that's what I'm hoping is at a consumer level, that there's a great reappraisal of the role of each of us, not as doctors, not as other roles, but as this kind of new, powerful patient who's got all this information they never had before. So I'm excited about it. I think it's going to be interesting because some of the doctors that have reviewed the book formally are completely against this whole notion, which is not surprising. And maybe that indicates that we're making progress because most of the consumers who've read it and reviewed it have really been extremely supportive. So knowing this was not going to be accepted widely by the incumbents, that's kind of the price you have to pay to try to shake things up. And whether or not it's a book, this whole medical order is going to be shaken up considerably because it's just an unstoppable movement that's going forward. And we do have an issue that there aren't that many digital native doctors today that actually grew up with this. So we have a problem of there's a lot of aging physicians who more than half are over age 50, and so they're the kind of the older folks like myself, and so they're not exactly embracing a lot of this digital era that has changed things so much. And of course, when everything was paper, and it was a different time when patients were very much submissive and were not willing to assert themselves, it's a whole different look right now. Consumers could really take the lead here, but they're not yet organized. And with the power of social networking, they could be organized. But probably the first thing that'll happen that really sets this off will be one of the largest companies that say, we're not taking it anymore. We're going to have a new way of providing healthcare for our employee base, which today costs us so many billions of dollars. And we know that there's a great savings that can occur here. We now have the invasion, if you will, of all the big tech companies. We've got not just Google and Microsoft, but Apple, Samsung, Qualcomm, Intel, even Salesforce. All of them are making a big play in healthcare and medicine, and probably even Facebook will, and Amazon is now getting going. So you've got a whole new look because these companies said in the past, we're not going to touch this healthcare stuff because this is just, FDA, this is complex. But really, they've all come into it because they know this is the greatest growth opportunity. And I also think they're starting to realize that if they can help change medicine, that's something they'll be exceedingly proud of in the lineage of these tech companies, which up till now have just really stayed away. Startups are treated by hospitals kind of like how patients are treated by doctors, which are they're dissed, oh, a startup, you may not even be here next week. So, there's not a lot of respect given to startups. And there needs to be a more open willingness to at least consider this technology for its potential. So you need champions. You need, whether it's a doctor that's got an open mind or somebody in a healthcare administrative role, say, you know what, this looks really promising, and push it forward. Because it typically won't happen without that kind of trusted individual to be a real supporter. And so that's tricky. And I think that's what's holding us back, is this just general lack of high regard. The most exciting thing of all is where we go from here, and whether it's the newly trained physicians or whether it's entrepreneurs that are fulfilling unmet needs. This is so extraordinary because we've never had this profound change before in the healthcare landscape. And so there's opportunities galore, and we're going to see medicine go to an unrecognizable state over the next several years.